Gang. There's a nice ring to it. And she's the head of Denmaja. I'll find out what that means, where the name comes from, and all that. She's here in the studios with us. We're going to have a great conversation, as always. We're looking at home care in Ghana. The state of home care in this country, it presents a landscape filled with both challenges and opportunities. With the right investments in workforce training, technological and innovations, infrastructure development, there is a significant potential to improve home care services in this country, addressing the barriers to access, particularly in rural areas, and strengthening PPPs, public-private partnerships, can ensure that home care becomes a sustainable and accessible option for many Ghanaians in need. So our conversation today will go into the opportunities and challenges and why it should be given an ultimate priority. Welcome.
Hi, Jerry. Thank you very much.
You good?
I'm good.
You settled, you relaxed?
Yes, I'm relaxed.
Okay, yeah. Let's start with Denmaja Home Care. Where is the name coming from?
Denmaja. Denmaja is a combination of my siblings and our names. So I took the first three letters of my male siblings, and then the first two letters of my name, and attached it to it to create Denmaja.
Dennis, Mark, and Jasmine.
Nope.
Dennis.
No, you can't. I don't think you
Okay,
guess right. It's Denzel, Marvel, and Jasmine. Yes,
Denmaja. Denzel, Marvel,
Jasmine.
Okay, and then you started a home care.
Yep.
What is a home care?
It's a service provider which aims at providing quality assistance to individuals who need care.
Okay, so not necessarily the aged.
No.
Anybody who needs care at home.
Anyone who needs care at home. Children, adults, people recovering from accidents. Yeah.
Of all the things you could have done.
I know.
Of all the things you could have done.
I know.
What is the motivation for creating a home care service in Ghana?
Jory, you won't believe this, but when you go through some circumstances, you realize that you actually need some things more than you may actually think you don't. So my dad fell ill.
Okay.
A couple of years ago. And during his recovery stage, we were all, we all wanted to help his recovery stage. Everyone wanted to be there for him. But it got to a time we realized it had become a burden on the family. I had school back then. My mom had to go to work. The people in the house, everyone had something doing.
Okay.
So we started looking for someone to cater for him at home, give him the professional care he needs at home. But it was very difficult.
Not just the house help.
No. We
needed professional.
Yes, because he was going through the recovery stage. It was very difficult to find one. And it was quite a burden. So I took it upon myself to create a home care. Yeah.
Okay. Yeah. So this was like a personal experience, and then
Yes.
you grew it into
Yes.
Oh, wow.
Because it's actually a need when you think about it.
Of course. I mean, the first need was the one you saw at home. So,
Yes.
yeah, it means if your dad was going through a
Then
million other
someone else
Ghanaians,
is also going through the same
fantastic.
thing.
Oh,
Yeah.
wow. That's good to know.
Yeah.
But what's your background that made you feel, where did you get the audacity to decide that?
You wouldn't believe it, but I read public relations in school. So I have no connection to
with
healthcare.
nursing or
Nope,
anything like
nope,
that?
No.
Oh, wow.
I don't.
I mean, I'm sure by now, having owned a home care, you would understand the basics, the fundamentals. You now know the difference between a syringe and a needle and all that, right?
Yes, that's
but
right.
at the time you were starting, what was the experience like? What were you? Who were you that you went to register and said, I'm starting a home care? You went to get some nurses and all that. Give us a rundown of how this thing started.
I'm not going to lie, but it was very difficult at the time I was starting. I sometimes wanted to give up because I didn't know the head and the tail when it comes to home care. But I did my research. I had people that I communicated with. I made doctor friends, nurses friends, caregivers, and they helped me throughout my process. I also took some classes from some people which aided in me creating this home care company. So that's how come I came about it, and it all started.
Were you hands-on from the beginning in terms of providing the care, or you were just recruiting and putting the people on the field?
I was handsome, yeah.
Okay.
I wasn't.
You wore scraps?
Yeah, I did. I have pictures, videos.
And you were not just doing it for PR?
No.
I'm a PR person, so
No.
sometimes I everything comes from a PR angle for me.
No, not that.
Wow.
Yeah.
And you start a home care service. What were the big initial challenges?
Public awareness. So not a lot of people know about home care in Ghana, which is kind of a disadvantage, because in the beginning of me creating the home care company, we didn't really have much people coming in or calling in to book our services. So we had to go out and find customers, and we had to preach what home care is to the public. So most of the Ghanaians lack the knowledge when it comes to home care services. And also, I realized in my time of working, that financial constraints was a problem for families. People shy away from home care because they believe that home care is very expensive to attain.
Is it not?
It is, but for the major home care, we have a care plan whereby everyone is involved. We are not selective. We have a care plan tailored to people's budgets.
Okay.
So everyone is involved. You can bring your budget and we'll work around your budget. It's mainly about giving care to people. So if because your budget is not up to a certain standard, should we watch your loved ones die, or not get the necessary attention they deserve?
Are there people trained specifically to provide home care services? Or
Yes.
it's just nurses and the average person?
There are nurses and there are caregivers. There's a difference. Some caregivers are not necessarily nurses. They undergo under training to become a caregiver. Some nurses will give the medical aspect of the home care, but they do not have the compassion and empathy to take care of an individual. So in the major home care, we have training every month, even for our current nurses and the new ones who want to come into our company. We train them on how to care for people. We are very selective with the people we select at the end of the day. Because if you don't have the compassion for people, you can't work as a caregiver. You need the compassion, the love, the affection towards them to work as a caregiver.
You're saying that there is an opportunity in this industry, and that rather there is a lack of skilled workforce to provide this service. Is that the situation in Ghana now?
No, there is not lack of skilled workforce, because in Ghana here, we see a lot of trained nurses and caregivers coming in and out. We even see a lot of them traveling.
Okay.
In my company, we don't face those challenges. We have a lot of nurses available to deliver the care people need. So the only problem I am seeing right now is the awareness.
Okay.
Yes. It's not the skilled force or caregivers or nurses. Yes, it's the awareness.
I'm asking it because I'm looking at it from a demand and supply place. It is the demand that is not there. Mm-hmm. The supply is there, but the demand.
Yes.
Because is it cultural? Is it? Have you in your experience? You think it's a cultural thing?
I think it's a cultural thing, because you yourself know in Ghana, we not in Ghana, Ghanaians, we are hospital. We are loving.
Yeah, we're
we
supposed to
tend
be.
Care for people. It's in our DNA. It's in our nature. So we feel that it's a must or a need for a family member to take care of their loved ones when they are going through crisis. They do not find the need to, venture into other options such as home care. So that's basically why it's like how it is now.
Okay.
Yeah.
Because I expect you to feel guilty if you sent someone to go look after your mom when you could have stayed at home and looked after your mom.
And as I said, I was taking care of my dad. I was part of the people helping my dad in his recovery stage. I felt the need to do it because
It's
I
your
know
job.
he's my dad and it's my job.
Yeah.
He's taking care of me since I was a child. So it's my job to do so. So in that moment, I wouldn't think of going for a home care until I realized that it was becoming a burden. Not necessarily a burden, but like, I had school. I had to either be late for school or leave class early to come and take care of him. And yeah.
Yeah, I can get that. Because our cultural beliefs and practices normally would influence the acceptance and adoption of these things in our society. But from what you're saying, aside the time constraints on the one who has been left to cater for this person who needs help, what about the issue of expertise? You could give your time to your dad, but if you don't know paracetamol from aspirin, you do more damage.
Yeah.
Is that something you've also noticed in the system?
Yes. So once again, I'll use my dad. Some medications that were given to him, I had no idea about. Like, I didn't even know how to minister those medications. Yes. And it's a big issue. So this is why people need to come in for home cares, because the trained staff are there to cater for them, to monitor them when medication is administered to them. Yeah, it's very necessary and important.
Okay. Talking of trained staff, that brings me to my next question. Like, so is there a regulatory body or that has oversight over home care, or I can just go to registrar general and register one tomorrow?
No, it's not that easy.
You need whose permission?
HEFRA.
Okay. Okay, so it means that in your setup you must have some medical people in
Yes.
there. Who are those?
Practitioners, general practitioners.
You have general practitioners?
Yes. Nurses and assistants. Yes, those are the two main people you must have in your company.
And so when you decided to go into that space, what was your business plan? You were going to bring a medical person in to head, or to be what? You were going to be the boss, and what was the plan?
In the beginning, I didn't even know
That you would need.
we needed all these people.
Okay.
So it was, as I was researching, that I got to find out. And then I contacted my doctor friends.
Okay.
And they helped me out. Even some people I submitted to the HEFRA organization were not accepted because you need a general practitioner.
Okay.
To head the company. You need the certificate of a general practitioner.
Oh, wow.
Yes.
HEFRA really works like that.
Yes. They are strict.
Okay. Health facilities and what? Regulatory something, agency or something like that. Okay. So this person who has the medical qualification and is heading, what is the person's day-to-day role? I mean, because the person might also have his own practice somewhere. Yeah. What does a person do on a daily basis?
Well, he comes in if he's needed.
Okay.
Yes. When there are emergencies, that's when they come in, like the general practitioner comes in. And we don't only have a general practitioner. We have psychologists, occupational therapists. Yes, they work hand in hand with the general practitioner. So they all come in when they are needed. Yeah.
To have a home care service in Ghana, do you necessarily need a brick and mortar presence? Do you need an office?
Without an office, you are not going to get the certificate.
Yeah, I asked that because I know HEFRA is heavy on facilities. So
you won't believe it. When I started my home care, I started in my
house, your bedroom.
Hall. I know it sounds like one of those stories, but it's not one of those stories. I read online what you need, and I fixed it all in my dad's dining hall, and I made them come for the inspection. I was totally cancelled.
Oh, wow. They wanted you to have a separate facility.
Yeah, and I didn't understand why I needed to have a facility, because the work is not in the office.
That's why I asked
it's
that
on
question.
The ground.
Yeah, it's
so
in people's homes.
Yeah, why do you need me to have an office?
What did they say?
Well, they told me that it's very necessary to have an office. We need to see that you have the necessary equipment and tools needed for the for the job.
Yeah, it's true.
Yeah, you need to portray all these things.
Yeah.
Yes, which shows that you are serious about the work.
Yeah, I think that's a good point.
Yeah.
I supported them.
Yeah, I support it after.
After
got
you didn't like
really
it. Yeah, and when you liked it, you said,
understand it,
yeah. Because think of it this way: if it was open to everybody, I could set up one, and I wouldn't even need an office, and
And the funny thing is, I never knew people would be coming in to make enquiries. I think that's also why I didn't understand why they needed me to have an office. So when we started business and we had people trooping in and out, it's when I realized that it's actually a necessity. Yeah.
Otherwise,
Because how can somebody come to my dining hall?
Yeah.
My father's dining hall, to be precise.
Yeah, it's true.
Yeah.
It doesn't really help that way. It doesn't look professional. And people's health is like super important. So you can't. So aside HEFRA, are there other bodies you have to deal with to set up a home care service in Ghana?
Environmental Protection Agency.
EPA comes there to do what?
It's just it's part of the inquiries, the requirements. Sorry.
My producer is laughing.
Part of the
Yeah,
requirements.
the way I asked the question because I'm wondering what is there.
You need a national service certificate. Sorry, not national service. Sorry. We need the
National health.
No. The fire service.
Fire, yeah.
Exactly, yeah. So these are some of the bodies you need to.
Wow. How do you determine how much to charge a particular customer or client? Don't give me figures. I mean,
I'm not gonna give you figures.
Yeah,
I mean, our rates are quite affordable. They are very, very affordable. And once again, your affordable may not be another person's affordable.
Yeah.
So as I said earlier on, we have a care plan which tailors people's budgets, for us to work with their budgets.
Oh, interesting. So
I can't really tell you how we get
trade secret.
Yeah, I can't really.
I understand. I mean, the idea behind this segment of the show is to have discussions on the challenges people are going through and anyone listening to us. And we know decision makers, duty bearers, and people in high office listen to us. So the idea is if they can help, then they help. And then also, if there's someone sitting somewhere listening to us and he's saying, okay, so this is an area I can call the manja and help them with, or I can go partner them or something.
Yeah.
That's why some of these things come up.
We are also partnering with NGOs to help us make home care affordable to others.
Oh, okay.
Also, we are in talking terms with the government to help us create more awareness on home care and make it more accessible to people. We would like it if the National Health Insurance plays a major role in home care service, which will also bring down the cost of home care in Ghana.
Oh, okay. Is it an industry or it is Demanja charting a course as a sole or as a lone ranger? Is it an industry? Are there other home care services?
Yes, they are. They are.
Plenty?
Couple. No.
Less than 10?
Okay. Well, per my research, there are quite a number of home cares. Yeah. But not all of them. You can't really get in touch with all of them because I made calls to most of the home cares and their numbers were unavailable. So there are quite a number of home cares, but getting access to them is difficult.
Would it be more than 10?
Oh, yes.
How come Demanja is the first I'm hearing of? And I'm not under a stone. I'm actually always out in the public, so I should have heard of them.
Well, I take pride in advertising my company. So that's how come maybe you've heard of Denmarja.
Okay, so now talking of Denmarja and marketing, what were some of the strategies you used to market Denmarja?
Social media was one of our strategies.
Okay.
Yes, we use social media to marketize Denmarja a lot.
Which platforms? And
YouTube,
what were you saying?
YouTube, Instagram, Facebook. What was I saying?
Oh, they were not videos, they were stills.
I had a video. We created an advert.
And you were saying what? Because you're not a nurse.
Fast-paced world, finding quality care can be.
Did you speak in that ad?
Yeah.
And what did you say?
In a fast-paced world, finding quality home care can be overwhelming. But at Denmark Home Care,
Oh, okay.
we have
I thought you start by saying,
with a
like,
background
I'm a nurse
acting,
of 10 years
with
experience.
a background acting, yeah, and we also use word of mouth.
Okay.
Yes, so that's also when we take care of this.
Your background acting.
No.
There were
we had
people behind
actors,
you.
yes,
Actors
yes,
were
yes,
behind
yes,
you.
yes.
Oh, okay. Oh, wow. Nice.
Yeah.
So social media, new media, then becomes a platform to market things like that. When did you come to the realization that, okay, you know what, this is a business? At what time in this journey, a startup, starting that's all, Hefra bouncing you, going up, and all that. At what time did you realize, okay, we have a business?
I think the first time I got a client.
Okay.
Yes, that was the first time during the week that I marketized my company. Yes, I got my first client.
And it wasn't your dad?
Nope.
Did you ever use...
No.
Oh.
He's well.
Oh, he was well before you started?
Yes.
Oh, so he never experienced
But
the
I
magic.
take care of him, so I still give him the major care.
Yeah, but this one is like dad level care. Yeah, I get it.
That, yeah.
So aside that, who was like the first? What was it like? Without mentioning names.
What was it like? I felt proud,
You had a call.
Yeah.
Please, am I talking to Dan Maja?
Yes.
My
and
son.
it wasn't one of those calls like whereby they'll tell you, I'll get back to you.
Oh, they were hiring you
Ready.
straight on board.
Yeah, and we had them for over a year.
So you get money. Plenty money. Okay. I mean, that's another that's another
So
conversation.
imagine having your first client for over a year.
That's like retainer levels day one.
Yeah.
Wow.
They talk to us to other people, other families. And we had other families coming in, calling. Yeah.
In terms of the demographics of those you serve, who are you serving a lot more of? The aged, the young, I mean, the mid-lifers. Who are you serving more?
The aged.
The aged.
Yes.
Okay. Wow.
The aged. Before it used to be females, a lot of females.
Okay.
But I think beginning of this year till now, it's been more males than the females.
Oh, wow.
Yeah.
Men are growing older.
So most of our nurses, our male nurses, weren't really active.
Oh, now.
Yeah. But now the male nurses
become.
are active.
So what you map, you match a nurse to a.
Yeah.
So you wouldn't send a male nurse to a woman.
Yes. Exactly.
You would. Is there a reason for that?
Well,
or is it Denmark policy?
it's a policy.
Okay.
Yes, and we need our clients to feel very comfortable.
Why are you sourcing these nurses and health workers from?
We don't have a specific place that we are sourcing them from. We are opened. Our website is there. Our emails are there. You just send your CV in. We take a look at your CV. We look at your files. When you pass the criteria, you undergo training. When you pass the training, we accept you into our care home.
Okay. So if there's a nurse or there is a doctor out there, please go to Denmark and go and drop your CV.
Yeah.
They might give you a call.
Yes.
And say, we have a customer. You call them customers or clients?
Clients.
I have a client who is in a wheelchair in this area. Mm-hmm. He needs ABC services. And then what? The person leaves, comes to Denmark or goes straight to the person?
No, it doesn't work like that.
What is the system like?
So what happens is we need to go and access the client. We need to go to the client's house. We need to take a look at the client's condition, his way of living or her way of living, what is necessary for them to do in the house before the nurse comes in, and what is necessary for the client himself or herself. Yes, that's the first thing we do. We have these contracts that we sign to make sure that we align with each other.
Okay.
And then the nurse takes it from there.
Oh, wow. Interesting.
But
What are some of the services you'll be providing for the average person, like the average client?
Mobilization.
You're moving them up and down?
Yes.
Okay.
Occupational therapy, psychological therapy, We have personal care.
Like what, bathing them?
Yes.
Okay.
Yeah. Some patients are bedridden, so they need excessive care. Yes.
That'll be more expensive.
It's all in the same. There's nothing higher than the other. And as I said, we have a care plan. So your budget, we work around your budget. Yes. We will give you personalized care if you need personalized care.
You cook for them?
Yes, we do cook for them. It depends.
Do you have a client you're cooking for?
Yes.
Based on a person's diet?
Yeah. That's why we have doctors on board.
Wow. Have there been clients that have made requests that you didn't anticipate, so it wasn't part of your contract or expectation? Has there been a client who said, okay, drive me around town, I just want to feel town? Like,
no, we can accompany you to town, but we will not drive you to town.
Okay.
Yeah, not all the nurses have the license to drive around.
I'm asking that because of the name, home care. And so in my mind, if you go out of the home, is it part of the services?
Yeah, it's for the client.
Yeah.
Anything related to the client. If the client wants to go for a walk, if the client wants to go to the hospital, shopping, anything, you have to go with the client. You must not be away from the client.
Oh, wow.
Yeah. Constant care. That's what they are paying for. And attention.
Are there clients that require your staff to sleep in their homes?
Yes. We have live-in services. So what we do is we provide 24-hour services, live-in services. We have half days and full days, 12 hours, 6 hours. Yeah. We are 24 hours. So anytime you call us, we are available.
Interesting.
Yeah, as I said, we have a lot of nurses available to give care to people.
Going to somebody's home to care for the person, anything to do with care comes with the word quality.
Yes.
What are the quality assurance or whatever who does what, so that we ensure that the quality is always there? Because the last thing I want is to hear that the person who came to take care of my mom stole her gold ring.
Yeah.
What do you do? How do you?
So
what are the assurances?
There are police background checks on our nurses, and as I said, our work speaks for itself too. So aside the police background checks, our nurses undergo excessive training for a month. Yes, to know how to cater for the patients in their homes. That's basically it.
So the manager would give you a contract, and then the manager would train you also. Okay, before we unleash you on the
if there's
client.
Any trouble, it comes on the manager. So we need to make sure that you are well equipped, knowledgeable.
Interesting.
Even if you know from wherever you are coming from, you still need to undergo the training.
So that you would appreciate the Denmarja way of doing things.
Exactly.
Okay. Is there a special insurance that comes with home care services? Because I'm thinking if of course, every business needs some kind of insurance. Is there something special for home care services?
Well, something special for home care services.
Yeah. So if your nurse went in there and broke something, spoiled something, and the client is suing, is there a certain coverage that you just pay it out of pocket? Has it ever happened?
No, it hasn't never happened.
Okay, so don't see me as a negative
woman.
I'm just asking the questions, right? How has technology played a role in where Denmarja's got from there to here? And with technology, I'm asking questions that have to do with supervision and management.
Yes, exactly. So with technology, when it comes to Denmarja, we're able to monetize our staffs. We're able to monetize our staff, and we have a way where family members are able to also monetize their loved ones at home with their caregivers, which makes them feel very connected to their loved ones when they are away or whilst they are away.
By phone? You call?
Yeah.
And then what? You say do a video and let me see my mom's
calls,
face.
Yeah, videos. There's an app that we use to monetize.
Oh, there's an app.
Yeah.
What does the app do?
You log into the app, the time you go to the place, when you leave, vital checks are all placed into the app.
Oh, wow.
Yeah.
So then the person is able to also go into the app and
Yes, our
read
clients,
what
yeah,
you're saying.
Yeah.
Oh, wow. And that's like real time.
Yeah.
Okay. So you'll be at work, but
Yes, sometimes the supervisor doesn't need to actually go into the homes to check on them. You can just check on them via the app.
Oh, interesting. At least it gives the one who is paying the money some comfort that my mom, my dad, my auntie, my kid is being still on the issue of culture. Under what circumstance would the manja be recruited to care for a kid?
Okay, so
yeah, because I'm asking that because my mom, my dad, I could, let someone look after them, but my kid.
Yeah, people have that nature. Well,
you have kid clients.
Not really.
Okay.
Not really. We are yet to delve into that, so we'll be looking at that also.
Yeah. I'm asking that because I'm thinking, hey, when it comes to kids, mom wants to be there. Dad would want to give that
more attention.
And all that.
And supervision.
Do you work in relations with aside the medical person who is heading the whole organization? Are you working in collaboration with maybe hospitals or something so that there's something, ambulance services? How do you work with the medical community as a whole?
So our doctors on board have linked us to their hospitals they work in. We work hand in hand with them for them to provide us those services when the need arises.
Okay.
Yes. So far we haven't had the need for them yet.
Calling an ambulance for a client and all that. Okay. We hope it doesn't get there.
No, we are hoping so.
Yeah. Are there opportunities? So we've dealt with the challenges and all. Are there opportunities within the home care sub-industry, because I'm putting it under health itself? Are there opportunities within this industry that you think others can take advantage of, or you believe with Denmaja the door is closed?
Yeah, there are several opportunities in working in the home care industries, such as how can I put this?
More people need help.
Yeah, there are more people who need help in our society, so it opens up we have more training programs for caregivers, skilled caregivers to come in and then cater for people, the more people that need the help.
Okay.
Also, what's this called? Sorry. Collaborations.
Okay.
Yes. We have collaboration. We deal in collaborations with NGOs, government, whereby they ensure that they give us the necessary infrastructures and equipment we need for catering.
Talking of partnerships and collaborations, are there international ones that the Manja is involved in, or they are all local?
No, not yet.
Oh, okay.
All local.
Recently, there was an organization we spoke to that said they wanted to. The organization said they actually were looking for a way to partner churches so that they start day care for the aged. Yeah. Would that be something that the Manja would want to collaborate or partnership with them?
Community services. Yeah, we would like to partner with them. Yeah, I think it's a good opportunity to hop on. Yeah.
Interesting. Let me also find out. So it's almost it's 9:42, and we're having a conversation here with Denmaja. Denzel, Marvel, and Jasmine.
So
okay. Denmaja home care. It's something that I'm pretty sure people are listening to us and saying, "Oh, okay, we didn't know there was something like that." But yes, there is. And here at Z, we are very much interested in having this kind of conversations, just to ensure that we understand what you are also thinking. If there is somebody there who is listening, don't worry, you can go to the website. You can just Google Denmarja. You can find out a lot more about them. We would also be finding out those that need more help. We'll be pushing them there. Why not? We can even do some collaborations with you.
Yes, definitely.
To see how Z Multimedia can actually help.
Definitely.
How many years experience?
We are in 2 years experience.
Okay.
Yes.
Wow. And in the 2 years, off the top of your head, how many clients have you served?
Approximately, we have about 35 clients we've served.
Wow.
Yes, 35 and counting.
Very happy clients.
Yes.
Wow.
I think I work hand in hand with God, so.
Yeah, God is a partner. When God is your partner, you're sorted out.
Everything is perfect.
Yeah. For us, we're heavy on that. So when God is your partner, we sort it out. We also want to find out from you what a team looks like. What is the structure of a home care service vis-a-vis Denmarja Home Care? You have the medical person sitting as a chief executive, and then who.
So the medical person, the practitioner, the nursing assistants.
Okay.
Yes, they are the ones who go around and check if everything is in order. Then we have the admin.
Okay.
Yes. Then our nurses.
Oh, okay.
Follows, yes.
So it's the regular staff are just a few.
Yeah,
but then
nursing assistant and the admin, then the CEO.
Interesting.
Yes.
It is the kind of discussion that I'm always interested in. Any final words? What does the future look like for the industry, and what does the future look like for you?
For Denmarja Home Care, we are looking to build an infrastructure whereby we will bring out families will bring their loved ones in. Yes, which will ease burdens on hospitals and also on the families as well. Yes, and our work speaks for itself once again. So I will entreat everyone to find personal and professional health care for their loved ones in their various homes. And they should be rest assured that the love and the compassion they need or they desire will be given unto them.
Thank you very much, Jasmine Jan, for coming through this morning. It's been an interesting and intriguing conversation. Denmarja Home Care, they're providing home care services for you and your loved ones. And so, and like you heard, there is an opportunity in that space. Thank you so very much. When we come back, we've just about a few minutes before we wrap up for the week, not just for the day, but for the entire week. You should understand that if for nothing at all, this is the first week of the new look morning show on Z101.9 FM. It used to be Z in the morning. Now it's Business Breakfast on Z. And Business Breakfast is celebrating its first week in existence. And that is cause for us to celebrate. When we come back, we're wrapping up for the week.